It's time for Medical Monday right here on eRadio with ophthalmologist Dr. Dylan Joseph. How's it going, Doctor?
Eon, well, thank you, and yourself?
Good, thank you. Tell me, how did the launch go? You officially opened your George branch last Monday. How did it go?
Yeah, a week ago today. It went really, really well. I think it was well received by our colleagues. We had a lot of optometrists there to welcome us, and even a few prospective patients who are interested in laser vision correction surgery. And I think the message of myopia control and laser vision correction and dry eye was hit home really, really well. And I think there's a great need for the area, and so we're looking forward to the future and very excited about the clinic.
So Beate Parsons is up and running in George. That's fantastic.
Yes, yeah, we've basically put the infrastructure in, and we're linking the two practices at the moment. It's an incredible amount of software and IT that goes into making sure that they're linked well, so that we've got real-time data communicable between the two practices. Yeah, I think it's going to be a great venture, and from next week, basically, I think we can start seeing patients. We wanted to make sure that every box was ticked before we got into clinical practice. Yeah,
that's it. I'd be very interested to know more about the IT side of it. Just personally, I wonder how it's all linked and all that kind of stuff. You must tell me.
Yeah, well, we've got a fantastic chap that does our IT. It's a company called CastNet. Sadly, he's emigrated, but he's got a great team on the ground here. And I think COVID has changed the world, and we're still able to do the installation remotely. And he's been able to sit in The Hague in Holland and do it from there.
Wow.
As if he was here, which is fantastic. How it has all changed.
That's fantastic, isn't it? So we're talking today about cataracts again. We spoke about it briefly before, where we explained more about it, but today you're taking us through the whole process from sitting in your office to going to hospital. So let's talk about the advanced eye assessment first.
Why we've called it the advanced eye assessment is it's exactly that. When a person comes into the office, they really want to know about their eye's health. So we give them an in-detail analysis of every part of their eye, from the back, from the optic nerve to the retina, to the macula, the blood vessels, the gel inside the eye, the lens towards the front of the eye, and the cornea, as well as the tear film. And they will be able to see images and scans, videos of their eye in detail. And that's why we've called it the advanced eye assessment, as opposed to a cataract evaluation or a LASIK evaluation. Because sometimes, depending on a person's age, they may come in and thinking that they're a good candidate for a laser procedure, or thinking that they might have cataracts. But at the end of the day, they've got dry eye, or they do qualify for a laser procedure, or rather a lens-based procedure. So we try to make sure that the patient doesn't have a preconceived idea of one procedure, because refractive surgery entails a number of different procedures. And it's about empowering that patient at the end of the day to say, look, this is exactly what's wrong with my visual system. This is how it can be fixed. We do audio recordings of the consult, so that you can listen to that as many times as you need to at home. We send you videos of your problems, so that you can watch those at home, and your visual solutions. And then, if you've got any questions after that, you email us or you give us a phone call, and we talk you through it until you know exactly what the best fit for your eye is going to be. So that's the advanced eye assessment.
Okay, so you go home with your own, I didn't even know, your own audio recording and video and everything. That's so nice. You're almost going home with your own podcast.
Absolutely.
That's really cool.
And I think there's so much detail involved in it, and it's so overwhelming.
Yeah.
Sitting there listening to every part of your eye and anatomy and what your options could be, and often there's not just one option. So as I said, you can be quite overwhelmed thinking that you've come in with one idea and you go home with 3 or 4.
Yeah.
And then to be able to digest that in your own time is really important. And that's why we found it such a good addition to our clinic to be able to offer that service to our patients. And it really, I think, makes that decision-making journey and process a lot easier for them.
Absolutely. So now you can go home and in your free time listen to everything again and just, as you said, digest it. But Dr. Dillon,
100%.
let's say now you diagnosed me and you told me I'm a good candidate for cataract surgery. What are the 2 questions that I should ask myself before I go into surgery?
Yeah, so not only applicable to cataract surgery, but to, for example, a customized lens exchange where you don't have a cataract. You may not be a good candidate for laser vision correction, but we can still go and take your own lens out, same surgery as cataract surgery. Or perhaps you're a good LASIK candidate. You've got to sit there and ask yourself 2 questions. 1, do I want to improve my vision? And secondly, do I want to reduce, if not eliminate, my need for spectacles and contact lenses and or reading glasses? And if you can answer one or both of those questions confidently, then you are at the right time in your life to make that decision to, then walk the visual journey with me. If you're not confident about answering those questions, then we delay it another 6 months, another 9 months, another year, until you make those decisions. I can tell you what we can do for your eyes. I can tell you what may be wrong with your eyes and how we can fix it. But at the end of the day, it's always in your hands to make that decision. And that's why it's so important to have the power and the access to that information and understand what's going on and what your options are before making that decision. And I tell everyone that. And I think if those are the 2 take-home points, you say to yourself, right, do I want to improve my vision, and do I want to reduce my dependence on spectacles, contact lenses, and or reading glasses?
And now, Dr. Joseph, I'm leaving your office and we're getting a hospital date and we have to talk about the admission process.
Yes.
So I get to the hospital. Do I need to have a COVID test?
Yeah, so with our day clinic that we operate out of, it's a day facility. So we do not admit patients. We do not admit acute patients, meaning ill patients, and there are no overnight patients. So it's not a general hospital that looks after sick patients. We work at Advanced Health Day Center in Knysna, and their policy and protocol is that if you're having day surgery, that at least 24 to 48 hours prior to surgery, you need an antigen negative COVID test, which includes going, down to the PathCare, your local PathCare or AMPath, and taking a nasal swab, sending it off, and we get the results SMS to us and emailed to us. And Mariska, our front patient liaison officer, is really on the ball with that. So she helps the patients through that journey. She tells them and informs them how to do it, where to go, as well as their authorizations and pre-authorizations for medical aids, what their co-payments may be. So we really try and make that journey as efficient as possible, but it's important to know, what you're in for at the end of the day, and that process involved before being admitted to hospital. And once you're in hospital on that day, then it's a separate journey as well.
Is there anything else you'd like to mention about the protocol in the morning? Is there something I should do before I come in, or something I shouldn't do, maybe?
Yeah. Most of our anesthesia is conscious sedation. So you have a drip up, you're nice and drowsy. We put lots of numbing drops onto the surface of your eye, and you do not feel anything. I think that's the one thing people panic about, and how to keep your eye open. We do that all for you, and you really do not feel anything. In fact, a lot of the medications that we give you intravenously take away your short-term memory, so you don't remember it as a bad experience.
Wow.
And Mariska is incredible. She comes through to the patients in the morning, and she'll chat to them and put them at ease. It's really, really a great added benefit that Mariska does. And it's about developing rapport with your patients and making them feel that this is home. And the clinic as well, the clinical staff are really excellent, and they go the extra mile to make you feel comfortable and at ease as well. It is, after all, an operation on, in my opinion, your most precious sense, your sight. So you're naturally nervous, and you want to be put at ease and to make sure that you're comfortable. And the experience is basically it's a half an hour surgery in theatre. You're in the post-op ward for a couple of hours until the staff feel you are healthy enough to be discharged, and then you're on your way home, and you're in your own bed for that evening.
So, Doctor, I also wanted to ask you, during the surgery, when your eyes are open like that, is there no desire at all to blink?
So the topical drops, so the anesthetic drops that we use, as well as the combination of the sedation and the fact that we hold your eyelids open. So we've got a little device that keeps your eyelid open for us. Takes away that blink response. It's quite incredible.
Okay, wow.
So you don't consciously think then about blinking.
Wow.
That is all taken away for you. Yeah.
Oh,
it's a very good question. There's LASIK and cataract surgery. People, it's the big thing that keeps them up the night before is, how am I going to keep my eye open? But really,
what if I want to blink?
You don't need to stress about that at all. I certainly won't be able to operate in between your blinks.
Yeah,
that's for sure.
Imagine. That would be hectic. But I was also going to ask you now. Should I be nervous or anxious about surgery? But it's very reassuring what you're saying.
Yeah, I think if you're not nervous, you're not normal.
Yeah.
And I think it's about the process of making a person feel comfortable, making them feel confident in the decision that they've taken to undergo a customized lens exchange or a cataract procedure. And then it's about that whole preoperative experience with our staff, with the ward staff, the surgery journey itself, and then, of course, the postoperative care. We are critical about postoperative management in terms of surgeon-led postoperative management. I see the patients myself on day one. I see them at week 1 and at week 6 after the surgery, and anytime they feel necessary during the rest of the course of the postoperative period, be it a year, 2 years, 3 years, it doesn't matter. What is really great is the movement into co-management. So our optometrists in the garden route are very well versed with postoperative care and management of cataract and lens surgery, and they often see the patients, and if there's issues, they pick that up and they're quickly onto the phone with us, and we can sort those out together.
So patients are also obviously given a sedative with a tranquilizing effect. So I suppose that also helps a lot with the nerves and the anxious feelings.
Yeah, absolutely. So so before you go wheeled into theatre, so you already have your drip up, a little bit of a pre-med, what we call sedative, basically to relax you, and then once you're in theatre, then it's a more steady sedation where you don't feel the need to jump off the table, so to speak. And no, you're very relaxed, and most people don't even remember the experience. Or actually, a lot of people tell me it was that pleasant they look forward to their second eye being operated.
Well, that's nice. The good stuff.
The good stuff.
Dr. Joseph, also want to ask you a very interesting question. Can I have both eyes done on the same day, or is that not possible? And what are the risks if you do both on the same day?
Yeah. So for a long time, it was thought that it's best to operate them on your eyes on separate days, and for a number of reasons. One, postoperative outcomes. So you're chasing good visual outcomes. If you're slightly off target on the one eye, you could adjust for the second eye, which is a very valid reason. But watching our nomograms and how tight they are nowadays and how accurate our postoperative results are, that's become far less of a risk. So that risk kind of falls by the wayside. From a risk of infection, the risk is 1 in 10,000 having infection inside the eye, which is very low. And if I'm operating both eyes on the same day, we completely take off all your drapes. My staff go and rescrub, I go and rescrub, and all of the instruments that are used on the first eye are taken out of the theatre, and we use a completely new sterile set of instruments. So your theoretical risk of infection operating on the day or operating a week apart is is identical, essentially. So a lot of patients who are either elderly or have a lot of other issues, comorbidities, like perhaps dementia or high blood pressure, cholesterol, they're traveling from far, or they don't want to come into hospital and potentially be exposed to COVID on multiple occasions, that they feel that they'd rather have it done in one sitting. And we absolutely do that. Routinely on my lists, once or twice a week, I'm operating both eyes at the same time. And it really is convenient for the patient. So we discuss all of that preoperatively as well and go through those options. And if they're happy with that, then we certainly do that for them.
Thank you, Doc. Moving on now, lastly, to the post-operative experience. Afterwards, can I see what's going on?
Absolutely. It's not like the good old days where you had to sit in a dark room for 3 days and have a patch over your eye and then a dark shield over that. We don't even tape the eyelids closed anymore. The wounds that we make are 2.5 millimeters wide, and we don't put stitches in. So literally after the surgery, we put a clear eye shield on with holes in it so that it can breathe, and you can still see through that shield. Even if you've had both eyes done, you're in your own bed that evening, and you come back to the clinic the next day, and we take off those shields. And in terms of your recovery, it's usually very quick. Within a day to 2 days, you're up and running and functional. You could be playing golf that weekend. You could be running.
Wow.
You could be cycling, walking, doing gym. We avoid swimming for 10 days, especially in dirty water. But in terms of your lifestyle, modern day cataract surgery and technology has made it a lot easier to get back to your life within a matter of hours to days. So the experience post-operatively is vastly different to what it was 30, 40 years ago.
Yeah, it's nice. Well, it at least it changed for the best. But the other question is, do I need to put dark sunglasses on like a celebrity when I go outside, or is that not necessary?
Well, after LASIK, after lens or cataract surgery, there is some inflammation in the eye and there is some light sensitivity. The surface of the eye may be dry, and dryness equates to light sensitivity. And for that reason, yes, we advocate the use of a good pair of ultraviolet sun blockers. And you can wear that for a week, for 10 days, for 6 weeks. It doesn't matter while you're outside. And if it helps with the glare. If you feel that you don't want to use them, you don't have to. Our modern day lens technologies have an inbuilt ultraviolet filter. So they block out the harmful light rays. They don't tint, however, so they're not going to go dark in your eye, but they will keep the harmful ultraviolet out your eyes. But if you are light sensitive, then absolutely be a celebrity. There's nothing wrong with it.
And then also, when will I see you again after the surgery? This is quite a funny question with a lot of meanings, literally and figuratively. But when will I see you again after surgery?
Well, hopefully literally and figuratively the next day. After surgery, day one. If you've had lens surgery, it's day 1, day 6, a week later, and then week 6. And all going well, then at a year after surgery. So 90% of patients who have had lens or cataract surgery are bang on target and they're happy with their visual outcomes. 10% may need a laser enhancement, a touch-up of laser at the 6-week mark if they are not completely satisfied with their visual outcome, or if they don't mind going back into specs, we chat to their optometrist and they go back and get spectacles made. But from a laser vision correction perspective, we see you at day 1 and usually week 6, and either 3 or 6 months, and then once a year. Yeah, the intervals get stretched. The further down the line we are from the surgical date.
And then the final question, Dr. Joseph, just to sum it all up, if you have to say, how fast is the visual recovery in general?
So with cataract surgery, modern day cataract surgery, the lens technology, the accuracy of the lenses, most people are seeing really well 24 hours after the surgery. What happens with lens surgery, that the lens does take time to settle into its place in the eye, and that can have an impact on your vision, and that generally takes 2 to 3 weeks. But by and large, most people are seeing really well within that first week after surgery, or at least for the target that we've set them for, be it reading, computer, distance, or a combination of the both. LASIK surgery is very quick. Within 24 hours, a lot of my traveling LASIK patients are able to drive themselves home if I feel that their vision quality is good enough. There are certain laser procedures which do take longer to rehabilitate, so we advise not to drive for a little longer after surgery. Unfortunately, with the majority of the procedures, visual recovery is within 24 to 72 hours, and you're up and running and functional again. So downtime is minimal, thanks to very small incisions, to modern day lenses, and to very accurate machines that we use to calculate the lens strengths.
Dr. Joseph, you make it sound so easy. You know that.
Well, the art is in the science, and the science is in the art.
Yes.
It's it is a lot of info, and it's a lot of monitoring your own data, following your own outcomes, feeding that back into the system, and that's why we also have a full-time mathematician in our office who is constantly looking at post-operative outcomes and feeding that back into the system to make sure that we are really fine-tuning our data and outcomes as much as possible.
Very advanced indeed, and very insightful again today on Medical Monday. Dr. Joseph, last thing is for you to give me your contact details. Give us your contact details.
Right, Eon. So, our direct landline number is 044-150-0085, and you can speak to Mariska. She'll be able to answer all your questions. That's email is info@drdillanjoseph, so drdillanjoseph.com. And we've got a YouTube channel which answers a lot of these questions as well. We have a ton of videos explaining LASIK lens surgery, cataract surgery, and we've also got social media platforms, Instagram and Facebook. Google us, find us there, and if you've got some questions, you can even fill in an online question form, and we'll get back to you.
Thanks, Doc. And then obviously next week, also just a bit of a teaser for next week, we'll be talking about medical aids as well and how they tie into all this. That's going to be very interesting.
Yeah. Absolutely. I think it's a discussion probably worth an hour or two, but we'll try and compress it into a couple minutes.
Good stuff, Doc. Thank you so much. Until next Monday, enjoy the rest of your day.
Thank you. You too, Jan. Take care.